Hi, I'm Regillo. I'm the director of the Retina Service at Wills Eye Hospital in Philadelphia, professor of ophthalmology at Thomas Jefferson University, and partner at Mid-Atlantic Retina in the Philadelphia area. Port delivery system is a device. It's a sustained release reservoir device to administer ranibizumab in zero order-like kinetics over long periods of time, at least 6 months. And we've got 7 years of data presenting here today, and that's the longest of any wet AMD clinical trial program ever. So up to 7 years of follow-up from the original phase 2 study where patients were implanted with PDS, and the control arm that got the injections rolled over to get the PDS, so almost as long with that control arm. And so we have a wealth of information on both long-term efficacy of managing wet AMD, and in particular, managing wet AMD in the maintenance phase with sustained delivery. And even also, as important, is the long-term safety. Because at first, most of the AEs, the adverse events, come around the time of surgery or shortly thereafter. And the good news is, over time, we see less and less of these, although we're not ever out of the woods from the possibility of a side effect or adverse event when a patient has a device in their eye. But it's comforting to know that we have 7 years of follow-up, that we can tell patients over the course of the time we're treating wet AMD, which is usually about 6, 7, 8 years on average for patients, what to expect having this device. The latter portal extension program is almost like having, but not quite, like having PDS in the real world. We don't have a lot of real world data, and I didn't present real world data here at the meeting, but when you compare what port delivery system can do for disease control over a very long time frame to real world anti-VEGF biologics injections that we do, it clearly outperforms. We get much better maintenance of the vision gains through the maintenance phase and hold on to those gains much better. There's very little decline that occurs in the BCVA-based corrected visual acuity on average over the course of 7 years, which we've never really had a study that can compare to that. Patient selection is always very important. And the type of patient that would benefit most would be a type of patient that either requires frequent treatment to adequately control their wet AMD, and or finds it difficult to get to the office, to get their injections on time, doesn't like getting injections, a lot of anxiety or even discomfort associated with injections. That's all factored in when we consider a patient that we might want to recommend the port delivery system for. So there's a lot of reasons. It's not just for the, quote, frequent flyer, although that is a very good candidate to consider port delivery system. And so patients can do very well in the real world, getting in some injections as infrequently as every 3 or 4 months. Those patients would be perhaps less inclined to pursue this type of therapy, but for patients getting injections more frequently, certainly every 4, 6, even 8 weeks, that's clearly the sweet spot. Well, the good news is it's comforting to know that with sustained delivery, we do get optimal control of disease. So that actually opens the door for all other approaches that are considered sustained delivery, whether it be bioerodible inserts with TKIs, whether it's gene therapy, or other sustained delivery systems that could be tested in the future. It tells us this sort of zero-order, continuous-like delivery is really the best way to control wet AMD and, frankly, probably most of our common retinal diseases that we manage with anti-VEGFs, like diabetic retinopathy, diabetic macular edema, for which the PDS is actually FDA approved for, now all those indications. Like with anything, and of course, depending on the platform, there could be unique or different types of adverse events, and you'll need programs like the portal extension program and port delivery system to really get a good feel for the long-term safety, much beyond the 1 or 2 year typical time frame that we test our biologics. Yeah, I think we're clearly going in the direction of sustained delivery in general to manage wet AMD in the maintenance phase. I mean, anti-VEGF biologics injected in the office is not going to go away. It's the best way to get the disease under control. But once the disease is under control, maintaining the vision gains and the exudative features that we get early on in the induction phase is probably the best way to manage these conditions.